Hello everyone, welcome to Raaonline. Today we will discuss our new chapter, that is reproductive health, right? What is reproductive health? Actually, it refers to the healthy reproductive organs with the normal functions, right? With their normal functions. As we know that according to WHO, that is World Health Organization, right? Reproductive health means the well-being, social, physical and mental level, right? Well-being at the physical, social and at mental level, right? So in that reproductive health we will study about the all reproductive measures, right? How can we maintain our health, to maintain hygiene condition, right? And related with all STDs and all these things we will study under that, right? We'll study in that contraception, about the contraception, the contraceptive devices, all these things, right? So come to the first question. What is the full form or of the RCH, right? What is that RCH? RCH full form is the Reproductive and Child Health Care, right? It is RCH, that is Reproductive and Child Health Care, right? Come to the next question. Reproductive health in society, it can be improved by, how can we improve our reproductive health, right? First, introduction of sex education in schools, yes, right? Reproductive health in society can be improved by giving the sexual educations in schools, right? How if when at the pubertic age, when the menstrual cycle appear, right, then what kind of condition we have to necessary to maintain it, right? What is the good touch, what is the bad touch, all these things, right? Nowadays in schools there is a specific session of the sex education which is giving to the students, clear? Now come to the second, increased medical assistance, obviously, right? If we will suffer from some diseases, so how can we cure it, right? And what kind of preventions or the precautions we have to take, right? So all these things, right? Third one is the awareness about the contraception and STDs. Obviously, if we are not aware with these contraceptions and the STDs, then we will not be able to protect from these kinds of sexual transmitted diseases, right? Unwanted pregnancies, clear? Equal opportunities to male and female child, exactly, so we can reduce the female feticide, right? Ban on the amniocentesis, exactly, clear? Amniocentesis, why? When we talk about that amniocentesis, actually that is the process through which we will examine the chromosomal abnormality of the growing fetus, right? But as we know that we humans are we humans misuse that process, right? This process, primarily the primary motive of amniocentesis is to detect the chromosomal abnormality, but in most of the cases it is used for the sex determination, right? And in that manner the female feticide will is increased, right? So that's why government ban the amniocentesis, right? Encouraging myths and misconception, no. If we encourage these kinds of myths and misconceptions, then what will happen? It will harm our society, right? So all these things is improved, but this is not improved, this, clear? This is not the improvement pattern, clear? So 1 2 3 4 5, that is all no. 1 2 4 6, no. 1 2 3 4 5, exactly, and 2 and 5, but the most appropriate answer is C, right? Now come to the next question. What is amniocentesis, right? Amniocentesis is the process used for to detect the chromosomal abnormality and as for the sex determination also, right? But the primary motive is the primary motive is to detect the chromosomal abnormality. By the use of a syringe, we retrieve some amniotic fluid, right, and examine in the laboratory. So that process is called the amniocentesis, right? A prenatal fetal determination test, okay. The postnatal fetal determination test, no. It is based on the chromosomal pattern of the amniotic fluid, exactly. It is based on the chromosomal pattern of the chorionic fluid, no. It is based on the chromosomal pattern of the amniotic fluid and the seminal fluid, no. It is just based on the chromosomal pattern of the amniotic fluid, right? So the correct answer is 1 and 3, right? So the correct answer is 1 and 3. Now come to the next. Where was Saheli developed? It is that Saheli is a non-steroidal contraceptive device, right? It is developed in the Central Drug Research Institute, Lucknow, right? So CDRI Lucknow. Fourth answer is Bombay. Clear? These are some points and we have to choose the causes of higher population growth, right? What is the higher population growth? Rapid decline in death rate. Obviously, if the death rate will be declined and birth rate will be increased, then in that cases what will happen? Population growth is high. Clear? Rapid increase is MMR and IMR. No. Maternal mortality rate and infant mortality rate. If it is increased, then what will happen? That MMR is maternal mortality rate, IMR infant mortality rate, right? Infant mortality rate and MMR, that is maternal mortality rate, right? So if rapid increase in MMR and IMR, so it decreases the population, not increases the population. So that is wrong. Rapid decline in the MMR and IMR, exactly. In that case, what will happen? The population growth is high. Increase in number of people in the reproductive age group, exactly, right? Rapid increase in death rate, no. So the answer is 1, 3 and 4. 1, 3 and 4. So answer is C. Now come to the next. What is the marriageable age for the females and the males in India, right? For females it is 18 years, for males it is 21 years. Clear? First female and then male, right? That's why that option we have not to choose that option. We will choose that option, that is 18 and 21, right? So that is the marriageable age for the females and the males in India, right? Now come to the next. What is the true for an ideal contraceptive? That is these are the exact lines of the NCERT actually, right? It should be user friendly. Obviously it should be user friendly, that's why it is called the true ideal contraceptive, right? It should be easily available, correct. It should be ineffective and reversible with least side effects. No. It should be effective and reversible with least side effects. Yes. It should be interfere with the sexual act of the user. No. Right? So these three are the concepts which is true for an ideal contraceptive, right? That is 1, 2 and the 4. 1, 2 and the 4. Clear? Now come to the next. What is true for the natural method of the contraception? Natural method of the contraception is the natural method. When we talk about the natural method, right? So natural method, that is avoiding that means the periodic abstinence, right, lactational amenorrhea and all these things comes under this. That means the natural way through which we inhibit the chances of the fertilization, right? So they increase the phagocytosis of the sperm. No, they employ barriers to prevent fertilization. No, it's not natural method, it is used by the barrier methods here, right? They are the natural way and this is the chemical method, right? This is the used in the chemical method. They are the natural way avoiding the chances of fertilization, yes, and they are the surgical method, no, right? So this is the surgical method, barrier method, chemical method, and that is the natural way to avoid the chances of the fertilization by the periodic abstinence, by the withdrawal of the penis just before the ejaculation of the semen inside the female genital tract, right? And third one is the lactational amenorrhea. These are the three natural methods, right, to avoid the chances of the fertilization. Now come to the next. What is true for the lactational amenorrhea? Actually, what is the meaning of that lactational amenorrhea? What is that lactational amenorrhea? Actually, lactational amenorrhea is based on the ovulation, right? That lactational, that means that is the time duration when female feed the child, and amenorrhea split that word. A, that means the absence. Meno and rhea. Meno, that is related with the menses. Rhea, that is discharge, right? That is absence of menstrual discharge is known as the amenorrhea at the time of the lactation when the mother feed the baby, right? It is based on the ovulation. Actually, ovulation does not occur during the period of intense lactation, right? As long as the mother breastfeed the child fully, right, then the fully chances of contraceptions are almost nil, right? So that is the lactational amenorrhea, clear? But it is effectively only up to the maximum period of the 6th month, right? Not more than that, clear? So now it means absence of true for the lactational amenorrhea. It means the absence of menstruation, correct. Ovulation does not occur during the lactational period, correct. Chances of failure of contraception are almost nil up to the 6 months of following parturition, exactly, right. Side effects are almost nil, correct. Contraceptive efficiency reduces after the period of intense lactation, correct, right. Contraceptive efficiency reduces after the period of intense lactation and it regains gradually, right. It is a natural method of contraception, exactly. It increases the phagocytosis of the sperm. No, it is the that occurs in the chemical methods, right. So all are true except that 7th one, clear. So 2, 3, 4, 5, 6, 2, 3, 4, 5, 6, okay, one is gayab, right. So all except this. So it is also correct and it is also correct, this is also correct and but it is wrong, right. But what happened, that is most appropriate, right. That answer is most appropriate. All are correct 1 to 6 but except the 7th one, clear. These are the statements and what is the true from above statements, right. Male condoms are disposable and female condoms are not. Is it right? No, it's not right, right. Even female condoms are also disposable, clear. Male and female condoms both are disposable, correct. Condoms are not disposable in general. Wrong. Condoms cannot be self-inserted. Wrong, right? So what is only 2 is correct and all are the incorrect. So we have to choose the true statement, that is only 2, right? That is the answer is C. Match the column, right? These are the contraceptive IUDs and all, right? And we have to match it. Now Lippes loop is related with the, it is non-medicated IUCDs, right? What is IUCDs? That is intrauterine contraceptive device. IUDs, that is intrauterine contraceptive devices. These are the devices which is used to prevent the pregnancy and inserted inside the uterus. That's why it is called the intrauterine. Clear? That's why it is called the intrauterine contraceptive devices, right? So now Lippes loop, non-medicated IUDs, right? Multi-load 375, that is hormone releasing IUD. CUT C7, that B, C and D, that is the copper releasing IUDs, right? That is B, C, D. That LNG20 is the hormone releasing IUD, right? And that progesterone, no, it's not applicable here, right? So the correct match is 1A, that is C and D cancelled, right? 2E, that is Bombay. Answer is Bombay, right? Come to the next. What is true for the IUDs, right? They are the self-inserted. No, they are inserted by the expertise, right? Expertise doctors and the expertise nurses, right? They are inserted by expert nurses, exactly. They may be non-medicated IUDs, copper releasing IUDs and hormone releasing IUDs, exactly correct. They are the one of the most widely accepted contraceptives in India, correct. They are intrauterine devices. No, they are the intrauterine devices. It's not inter. That's why that is wrong. Clear? So the correct answer is the Bombay. Clear? Come to the next question. IUDs increases the phagocytosis of the sperm. Correct or incorrect? Correct. Release the copper ions that suppresses the sperm motility and fertilizing the capacity of sperm. Correct. It makes the uterus unsuitable for the implantation. Correct. Make the cervix hostile to sperm. Correct. Prevent the semen from entering the female reproductive tract. No. Semen enters, but they just prevent the fertilization, physical meeting of the sperm and the ovum, right? So this is wrong. So the answer is 1, 2, 3, 4, 5. No, 1, 2, 3, 4, 1, 2 and 2. No. So the most appropriate answer is Bombay, right? What about the pills? Pills inhibit the ovulation and implantation. It is correct. Yes. Alter the quality of cervical mucus to prevent or retard the entry of sperm. Exactly. Prevent the ejaculated semen from entering the female vagina. No. Inhibit the spermatogenesis. No. Right? So just it helps in the inhibition of the ovulation and implantation, and they can change the cervical mucosa, right? So to prevent or retard the entry of the sperm, right? So the answer is 1 and 2. That is C. Clear? Come to the next. What is true about Saheli? It is developed at CDRI Lucknow. correct. Contains a steroidal preparation, no, it is non-steroidal preparation, right? Once a week pill, correct. Many side effects, not so much, right? So it is wrong. High contraceptive value, correct. Very few side effects, exactly, right? And low contraceptive value, no, clear. So the answer is 1 3 5 6, 1 3 to 1 3 5 6. So the answer is Bombay, clear. Rest of the cancelled. Sterilization in male, what is sterilization? Actually is sterilization, when we talk about the sterilization, what does it mean? Sterilization, right? See here, that is the male reproductive structure and this is the female reproductive structure. When we cut the vas deferens and ligate it properly, titrate properly, right, then what will happen? The we inhibit the path of sperm actually, right? So semen is released but without sperm, right? At that time, after that what will happen? The semen is released but without the sperm, and if the sperms are absent, then what will happen? There is no chances of the fertilization, right? So that's why that condition is called the vasectomy. Because we cut the vas deferens. And same in case of female, when we cut the fallopian tube and tied it, ligate and tied it tightly, then what will happen? We inhibit the path of entry of the sperm in the in the fallopian tube actually, right? So when we inhibit the path of the sperm into a fallopian tube, then what will happen? There is no chance of the fertilization, right? So what will happen? That condition is known as tubectomy, clear? So same, this is called these are the irreversible process, right? So the sterilization in males is called the vasectomy and in females it is called the tubectomy. Vasectomy, tubectomy, answer is A, clear? Come to the next question. Which of these set of diseases are completely curable if detected earlier? Hepatitis B, gonorrhea, syphilis, these are the STDs actually, right? And it's not so easy to complete, right? It's not, so that is wrong. In that, genital herpes and syphilis is covered, but chlamydiasis is also covered, right? They both are curable, but genital herpes is not, right? HIV, no, right? So the correct option is the chlamydiasis, genital warts and the syphilis. If we detect it early, then it is the completely curable diseases, right? Chlamydiasis is caused by the chlamydia trachomatis, right? Syphilis, that is treponema pallidum, clear, which is responsible for the syphilis. Now come to the next. People especially vulnerable to the STDs are in the age group of 15 to 24, 25 to 40, 5 to 12 or 14 to 60 after attaining the puberty, right? After attaining the puberty, and this is the age when the child is more attract towards the sexual activities, right? So that is the, and these are the more especially vulnerable age for the STDs, right? Just because of the multiple sex partners and without use of the condoms and all these things, right? So this is the age. Now come to the next question. These are the, actually it is related with the art, that is assisted reproductive technology, right? Assisted reproductive technology, clear? Assisted reproductive technology. What will happen in that case? There are some methods. First one is the zygote intrafallopian transfer, right? It is the, actually Come to these options. Zygote intrafallopian transfer. That means that option is wrong. It is not inter, it is intra, right? So the full form of ZIFT is the zygote intrafallopian transfer. That is 3. That is 3A. Clear? In which zygote is transferred into the fallopian tube. Clear? Then ICSI, that is intracytoplasmic sperm injection, right? We by the use of a needle directly in a petri dish, we insert the sperm, right, inside the ooplasm. Clear? What will happen in third? That is gamete intrafallopian transfer. That is 2. So 2C, 3A, 5B. So the answer is Bombay. Clear? Match the art with their description, right? Now come here. That is, in that particular, that is gift, right? Gift, that is gamete intrafallopian transfer, and in gamete intrafallopian transfer, what will happen? That is transfer of ovum from a donor to the oviduct of the recipient, right? So transfer, that is A5, right? That one, collected gametes are made from the zygote in the laboratory, right? In the laboratory, when we talk about the laboratory, then it is the intrafallopian in vitro fertilization, right? That is IVF, right? That is IVF. In vitro fertilization, that is IVF. Clear? Then what will happen? That second, that is the zygote or early embryo with up to 8 blastomeres is transferred into the oviduct. That is called the ZIFT, right? That is called the ZIFT. Clear? Then third, that is zygote with more than the 8 blastomeres is transferred into the uterus. That is called intrauterine transfer, right? That is called the intrauterine transfer. That is IUT, right? That is E. Now, fusion of gametes within the female. Fusion of gametes, that is 4. Within the female, that is inside the uterus. And when we talk about the smooth, or that is the smooth muscle, that is organ, that is, it is called the in vivo fertilization, right? Inside the body, that is called in vivo. Outside the body, when it is in test tube, then it is called in vitro, right? So the H and sperm is injected into the ovum in vitro, that is called ICSI, that is the D. Clear? So the answer is 1F. 1F is present in only B and C. 2B, okay. 3E, it is in C option, that is answer is C. Clear? Now come to the next 21. Coitus interruptus, that is the natural method, right? That is the natural method, is that coitus interruptus in which the ejaculation of semen does not occur inside the it is not ejaculated inside the female's body, right? That is called the coitus interruptus. Just before the ejaculation of the semen, the male organ, that is penis, comes out of the female's body, right? That is called the coitus interruptus. That means the coitus will not be completed in that manner. So the answer is coitus interruptus is the natural method, right? So the coitus interruptus is the natural method. Now LNG20, LNG20 is the IUD, right? It is IUD. And which one is also IUCD, that is the intrauterine contraceptive devices. that is, along with that, it is that multi-load 375 is also IUD, right? So D, diaphragms, that is the barrier method. Diaphragm is the barrier method, and Nirodh is also used in the barrier method. 4, that is the surgical method. Surgical method, that is the sterilization, right? Sterilization and the vasectomy, clear? And that the oral contraceptive device, right? So the oral contraceptive device is the Saheli, that is E. So according to that, the answer is the Bombay, right? According to that, the answer is the Bombay. Now come to the next 22. These are the contraceptive devices. These are the condom, that is the male condom, that is the female condom, right? That is the copper T, implants, that is the sterilization method, right? Condoms, copper T, that is implants, vasectomy, tubectomy, clear? So what will happen now? A, that is related with the condoms, that is 4, A4, it is present only in the C option, right? B5, C3, D, vasectomy, that is 2, and E, that is tubectomy 1, right? So the answer is C. Now come to the next question. Read the following 4 statements and mark the option that has both correct statements, right? MTP, what is that MTP? That is the medical termination of pregnancy, right? MTP, medical termination of pregnancy, right? That is called MTP, clear? Now what will happen? MTP actually in by the government of India, MTP was legalized in 1971, right? It was legalized in 1971 to avoid its misuse, right? So that is the correct answer. Inability to conceive or to produce the child even after 2 years of the unprotected sexual cohabitation is called the infertility, correct? Right? The surgical method of the contraception prevents the gamete formation. No, surgical method doesn't prevent the gamete formation. It just prevents the entry of the gametes, clear, in the fluid. Clear? MTPs are related safe up to the 12 weeks of the pregnancy, correct, right? So the correct statement is A, B and D. A, B, D, first option, right? So the 23. Now come to the 24th. Given below are the 4 methods and their modes of the action in achieving the contraception. Select their correct matching from the 4 options that follow, okay? That is the method and that is the mode of action, right? Now what will happen? The pill prevents the ovulation. That pill prevents the ovulation, right? Then the condoms prevents the sperm reaching to the cervix, right? So these are the barrier method, right? Now vasectomy, semen contains no sperm, and copper T codes prevent the implantation, right? That is the D. So 3, 2, nahi sorry, 3142, 3142 na 3142, right? So the answer is C. Reproductive health is completed in the form of the question, right? Thank you.